times a week, I do have patients come in with redness on their face, sometimes pustules that come with it, and oftentimes we diagnose this as rosacea. So rosacea is an inflammatory condition that causes sort of inflammation of the vessels on your face, which causes redness. Sometimes you can see what are called telangiectasias, which are little red vessels on your face. And sometimes it'll even come with acne, so little pustules often on the cheeks and the nose. So rosacea is something that, is a condition that oftentimes once you get it, is something that you can then have to kind of live with. And oftentimes it does come a little later in life, 40s or 50s or beyond are usually when people start to notice it, although you can get it younger in life. And rosacea is notorious for being triggered by certain things. So whether that's sometimes the sun can trigger it, certain types of food, particularly spicy food, might trigger your rosacea, trigger that redness, trigger some pustules which kind of look like acne. And there are other things. I always tell patients to keep a diary of what triggers their rosacea because it can be so patient specific. But the sun, weather, and foods or coffee are often common triggers that patients tell me about. So rosacea can be both chronic, meaning it's kind of always there, or it can be, like I said, kind of comes and goes depending on triggers. So common treatments we have for rosacea. One is usually people with rosacea prone skin, we need to think about sensitive skincare products, so things that aren't too harsh on the skin. So I always have them use, if they're washing their face, use a mild wash, a mild face lotion, and then also making sure they're putting on sunscreen because sunscreen is going to help protect from when you're out in the sun and that trigger. Other things we use is particularly for the pustular rosacea where you get those more like pimples, we use topical antibiotics, and also, there's a number of antibiotics we use. We can also use things that vasoconstrict, topicals that vasoconstrict the vessels on your face to kind of take the redness away. And then sometimes we do have some oral medications like doxycycline or other antibiotics we use to kind of reduce the inflammatory response and also those pustules. There are kind of two lanes we have to treat. We have to treat those pustules and that acne, but also the redness. The redness, a good thing to do for that is a topical called azelaic acid, which you can kind of use every day. But also for that redness, sometimes we need to go to those more, permanent procedures like lasers, which can really target those blood vessels, which can help permanently get rid of the redness. So as you can tell, there's a kind of a number of ways we can go down with treatment, whether you have mild or more severe persistent rosacea. There's a number of things we can do for it. So if you feel like you're experiencing these symptoms, come in and we can take a look.